Welcome to your personalized deep dive into the world of clinical psychological science.
Yeah.
We've got this really fascinating book here, packed with real case studies.
Oh, awesome.
Think of it
Okay.
like a medical drama, but for the mind.
I like it.
It's really amazing how clinicians can actually apply scientific principles to understand and treat such a range of psychological challenges, from childhood disorders all the way up to adult mental health.
Exactly. And this isn't just going to be about, abstract theories or anything. We're going to be looking at the nitty-gritty of how that science translates into real-world practice.
You'll get to see how these different therapeutic approaches that we've talked about, how they play out in individual lives.
Yeah.
And trust me, these cases are anything BOUT textbook examples. We're talking about real people facing real struggles with surprising twists and turns that will keep you hooked.
Oh, for sure.
Before we jump into the deep end, can you tell us a bit more about how case studies bridge the gap between research and what actually happens in therapy?
Absolutely. So case studies, they really provide a window into the real-world application of scientific methodology. It's not just about applying textbook knowledge, right? It's about taking that knowledge and using it to understand the unique complexities of each individual.
Okay.
And it all starts with ensuring that the goals of the therapy are actually driven by the client, not the therapist. So it's really a collaborative process.
So it's really a partnership between the client and the therapist.
Exactly. Yeah. It's about empowering those individuals to define what they want to achieve rather than, imposing some kind of predetermined agenda.
Right. And then there's the reliance on evidence-based assessment and treatment methods.
Right.
This means using tools and techniques that have been scientifically proven to be effective.
Exactly. So no relying on gut feelings or unproven theories.
Exactly. It's about grounding clinical practice in solid scientific evidence.
For sure.
And a key part of this scientific approach is the emphasis on a self-correcting process. So if a particular intervention isn't working, the clinician needs to be willing to adapt, to adjust, to refine their approach based on the client's progress.
Yeah, it's like a constant feedback loop where the therapist is continuously assessing and adjusting based on, what's happening in the therapy room.
Makes sense.
Yeah.
It's like being a detective, gathering clues, forming hypotheses, and constantly refining your understanding of the case as new information emerges.
Precisely.
Now, if you're ready,
Yes.
we can start exploring some specific case studies that bring these principles to life. Let's start with the world of childhood disorders.
Okay.
I'm fascinated by how these clinical approaches play out with younger clients. I'm ready to dive in.
All right, let's meet Alvin.
Okay.
A young boy struggling with anger and defiance issues. His case highlights the complexities of reactive attachment disorder, or we call it RAD.
RAD.
Yeah.
That sounds like a really challenging condition. What makes it so complex?
Well, so RAD often stems from these early experiences of neglect or maltreatment, and that can really disrupt a child's ability to form those secure attachments.
Those early bonds are so important.
They are, yeah. In Alvin's case, there's a possibility of early maltreatment, and it's really impacting his ability to trust and connect with others. And he's pushing away those who are trying to care for him.
It's heartbreaking to think about what some children go through at such a young age. It's no wonder they struggle to form healthy attachments later on.
It really is.
Yeah.
And Alvin's case also demonstrates how therapists will use a very specific type of therapy called parent-child interaction therapy, or PCIT, to help children with RAD develop those crucial attachment bonds.
PCIT.
Yeah.
This is interesting. How does it actually work?
So PCIT focuses on strengthening the parent-child relationship through these structured play sessions. The therapist coaches the parent in real time, giving them guidance on how to best respond to the child's behaviors in a way that promotes connection and positive interaction.
So it's not just about working with the child directly, but also empowering the parent to create a more nurturing and secure environment.
Precisely. It's really about equipping parents with the skills and knowledge they need to navigate those really challenging moments and build a stronger bond with their child.
It's amazing how something as simple as play can be such a powerful tool for healing and growth.
It is, yeah. And PCIT actually has this really fascinating history. It evolved from the work of this remarkable woman, Constance Sanchev, who developed a 2-stage parent training protocol.
Okay.
And although her work was never formally published, it laid the foundation for what we now know as PCIT.
Wow, that's incredible. It's a reminder that sometimes the most impactful contributions to science come from the most unexpected places.
For sure. And Alvin's case highlights how PCIT can be adapted to meet the unique needs of each child and family. The therapist worked really closely with Alvin's grandmother, who was his primary caregiver, to address his specific challenges.
So they tailored the approach to fit Alvin's specific circumstances and the dynamics of his relationship with his grandmother.
Exactly. And through that personalized approach, they were able to help Alvin develop a more secure attachment to his grandmother, creating a foundation for healing and growth.
That's so heartwarming to hear. It's a reminder that even in the face of early adversity, with the right support and interventions, children can find their way back to connection and security.
Absolutely.
Now, let's shift gears a bit and explore the world of autism spectrum disorder through the case of Jorge.
Okay.
ASD is a topic that's often misunderstood. I'm curious to see how it's addressed in this case study.
Yeah, so Jorge's case actually beautifully illustrates the principles of applied behavior analysis in action, or ABA.
ABA?
Yeah.
That rings a bell. I've heard it mentioned in relation to autism before.
Yeah, so ABA is actually a widely used therapy for ASD, and it's based on the idea that behaviors are learned, and they can be modified through reinforcement and other behavioral techniques.
So it's about understanding the patterns of behavior and then using those insights to create positive change.
Exactly. And in Jorge's case, the therapist used ABA to address a range of challenges, including communication skills, independent eating, and toilet training.
Wow, that's quite a range of areas to focus on. How did they approach each of those challenges?
Well, let's take communication as an example. Okay. Jorge was nonverbal. So the therapist used this technique called shaping, which basically involves breaking down complex skills into smaller, more manageable steps.
Right.
So instead of expecting Jorge to, speak full sentences right away, they started by rewarding him for making any sounds at all.
Interesting.
Yeah. And then they gradually increased the complexity of the sounds that he was rewarded for, slowly shaping his behavior towards more sophisticated forms of communication.
It's like building a bridge, one brick at a time.
Precisely. And they use a similar approach for independent eating. They started by rewarding Jorge for simply picking up his spoon and then gradually increased the complexity of the task until he was able to feed himself independently.
It's amazing how patiently breaking down those skills can make such a difference.
It is. And Jorge's case also highlights the importance of consistency, patience, and a deep understanding of those behavioral principles in ABA therapy.
And did Jorge respond well to this approach?
He did. He showed significant improvement in all three areas. So communication, eating, and toileting.
That's fantastic to hear. It gives so much hope to families who are facing similar challenges.
It does. But it's really important to remember that progress isn't always linear.
Right.
The book really emphasizes the importance of addressing regression and relapse, which are common occurrences in ASD treatment.
So even with the best interventions, there can be setbacks along the way.
Exactly. And therapists need to equip families with strategies to manage those setbacks and maintain the progress that their child has made.
It's about building resilience, both for the child and for the family.
Absolutely. And Jorge's case reminds us that ASD treatment is a journey, not a destination.
Mm-hmm.
It's a long-term commitment that requires patience, understanding, and a deep belief in the child's potential.
Now let's shift our focus to the realm of mood disorders,
Okay.
which affect a significant portion of the population.
Right.
Mood disorders can be so debilitating.
Mm-hmm.
I'm eager to learn more about how they're addressed in these case studies.
All right, let's meet Ruby, a woman struggling with depression. Her case highlights the crucial role a primary care behavioral health consultant can play in supporting individuals with mood disorders.
A primary care behavioral health consultant. That's a new one for me.
Yeah, so think of it as like a mental health specialist that's embedded within a primary care setting.
Okay.
They work closely with physicians to provide brief, targeted interventions for patients struggling with mental health concerns.
So it's about integrating mental health care into routine medical checkups, making it more accessible and less stigmatized.
Exactly. And in Ruby's case, the behavioral health consultant really helped her understand her symptoms, explore potential causes, and develop some coping strategies.
Okay.
And they also introduced her to acceptance and commitment therapy, or we call it ACT.
ACT. I've heard that term before, but I'm not quite sure what it entails.
Yeah. So ACT is a mindfulness-based therapy that focuses on developing psychological flexibility. It's about learning to accept difficult thoughts and feelings without letting them control your behavior.
So instead of trying to suppress or eliminate those negative thoughts, it's about changing your relationship to them.
Exactly. And the behavioral health consultant helped Ruby apply ACT principles to address her depression. For example, she was struggling with feelings of guilt and worthlessness, so they use a technique called diffusion.
Diffusion. That sounds interesting.
Yeah, so it's about recognizing that thoughts are just thoughts, not facts. It's about creating distance from those thoughts so they have less power over you.
So instead of getting caught up in those negative thoughts, she learned to observe them without judgment, without letting them dictate her actions.
Precisely. And through that diffusion technique, Ruby was able to reduce the impact of those negative thoughts and start taking action towards her goals.
That's really amazing how changing our perspective on our thoughts can have such a profound impact on our well-being.
It really is. And Ruby's case highlights how ACT can be a powerful tool for managing mood disorders, helping individuals find greater peace and freedom even in the midst of challenging emotions.
It's a reminder that we don't have to be slaves to our thoughts. We can learn to choose how we respond to them, even the difficult ones.
Exactly.
Now let's delve into the complexities of bipolar disorder through the case of Janice.
Okay.
Bipolar disorder is a condition I've always found really fascinating and complex. I'm really eager to learn more about how it's addressed in this case study.
Yeah, so Janice's case highlights the importance of differential diagnosis, which is the process of ruling out other conditions that might present similar symptoms.
So it's like detective work, carefully considering all the possibilities before arriving at the most accurate diagnosis.
Precisely. And in Janice's case, the therapist had to consider conditions like borderline personality disorder, substance-induced mood disorder, and even medical conditions that can mimic bipolar symptoms.
Wow, it's quite a list.
It is.
It sounds like diagnosing bipolar disorder can be quite tricky.
It can be. It requires a thorough assessment, considering the individual's history, symptoms, and even family history. And in Janice's case, they ultimately confirmed the bipolar diagnosis, highlighting the need for a really multifaceted treatment approach.
So it's not just about medication management, but also addressing the various aspects of the condition.
Exactly. Janice's treatment actually involved a combination of medication, psychotherapy, and what we call psychoeducation.
Psychoeducation, what does that involve?
So psychoeducation is about providing individuals and their families with information about the condition, treatment options, and coping strategies.
So it's about empowering them with knowledge and understanding so they can actively participate in their own care.
Precisely. And in Janice's case, psychoeducation helped her and her family understand the cyclical nature of bipolar disorder, identify early warning signs of mood episodes, and develop strategies for managing those episodes.
It's like giving them a roadmap, equipping them with the tools and knowledge to navigate the challenges of the condition.
Exactly. And Janice's case highlights the importance of a collaborative and holistic approach to bipolar disorder treatment, where medication, therapy, and education all play crucial roles in supporting stability and well-being.
It's a reminder that mental health care is not just about treating symptoms. It's about empowering individuals to understand their conditions and actively participate in their own recovery.
Absolutely. Now, are you ready to explore the often misunderstood world of anxiety disorders?
Definitely. Anxiety is something I think everyone can relate to on some level. I'm really curious to see how these case studies shed light on the nuances of this very common human experience.
Okay, then let's meet Annie, a woman struggling with panic disorder with agoraphobia. We call it PDA.
Panic disorder with agoraphobia. That sounds incredibly debilitating.
It can be. Annie's case really beautifully illustrates how clinicians use evidence-based techniques like cognitive restructuring and exposure therapy to help individuals with PDA regain control of their lives.
Cognitive restructuring and exposure therapy. Can you tell me a bit more about how those techniques work?
Sure. So cognitive restructuring involves identifying and challenging those negative thought patterns that contribute to anxiety.
Okay.
So for Annie, this might involve questioning those catastrophic thoughts like, if I have a panic attack in public, I'll faint and everyone will think I'm crazy.
Right. It's about replacing those fear-driven thoughts with more realistic and empowering ones.
Exactly. And exposure therapy, while it can be challenging, it's actually a cornerstone of PDA treatment. It involves gradually and systematically exposing individuals to the situations that they fear, helping them learn that those fears are often unfounded and that they can cope with those anxiety-provoking situations.
So it's about facing your fears head-on and realizing that you're stronger than you think.
Precisely. And in Annie's case, the therapist really carefully tailored the exposure therapy to address her specific fears, starting with situations that evoked mild anxiety and gradually progressing to those more challenging ones.
It's a step-by-step approach. building confidence and mastery along the way.
Exactly. And Annie's case really highlights the importance of that personalized approach to exposure therapy. What might be challenging for one person might be very manageable for another.
Yeah.
It's about meeting the individual where they're at and creating a plan that feels safe and achievable.
And how did Annie respond to this approach, this personalized approach?
She made incredible progress. She was able to gradually overcome her fear of leaving her house and engage in activities she hadn't been able to enjoy for years.
That's wonderful to hear. It's a testament to the power of these evidence-based therapies to really transform lives.
It is. And Annie's case really reminds us that even with conditions that feel overwhelming, with the right support and interventions, individuals can reclaim their lives and find freedom from fear.
Now let's shift our focus to the realm of trauma, exploring the profound and lasting impact it can have on the human psyche through the case of Hakim.
Okay.
Trauma is such a heavy topic. I'm ready to listen and learn.
So Hakim's case is particularly poignant because he's a torture survivor, diagnosed with complex PTSD. His story vividly illustrates the long-term consequences of trauma and the complexities of treating complex PTSD.
Torture survivor. That's unimaginable.
It is.
What makes complex PTSD different from regular PTSD?
So complex PTSD often arises from prolonged or repeated trauma, such as childhood abuse or torture, as in Hakim's case.
Okay.
And it's often characterized by this wider range of symptoms, including difficulties with emotional regulation, distorted self-perception, and problems with relationships.
So it's like the impact of the trauma is more pervasive, affecting various aspects of the individual's life.
Exactly. And Hakim's case also highlights the importance of that multifaceted treatment approach for complex PTSD. His therapists actually used a combination of emotion regulation training, trauma narrative development, and prolonged exposure therapy.
Wow, that sounds like a really comprehensive approach.
It is.
Can you tell me more about each of those components?
Sure. So emotion regulation training helped Hakim develop skills to manage those intense emotions, like anger, anxiety, and sadness, that often stem from trauma.
So it's about giving him tools to cope with those really overwhelming emotions.
Exactly. Trauma narrative development involved helping Hakim process and integrate his traumatic experiences into his life story. And this can be a really powerful way to reclaim a sense of agency and meaning after trauma.
It's like creating a coherent narrative out of a chaotic and painful experience.
Precisely. And prolonged exposure therapy involved gradually and safely confronting those trauma-related memories and triggers, helping Hakim desensitize to them and reduce their emotional power.
So similar to exposure therapy for PDA, but in this case, the triggers are trauma-related.
Exactly.
That makes sense. And through this multifaceted approach, Hakim was able to gradually manage his symptoms, process his trauma, and ultimately rebuild his life.
He was.
That's so inspiring to hear. It gives hope to others who have experienced similar traumas.
It does. And Hakim's case reminds us that healing from trauma is possible, even when the wounds run deep. It's a long and challenging journey, but with the right support and interventions, individuals can find peace, reclaim their lives, and rediscover hope.
Absolutely.
Yeah.
Now, let's explore another prevalent anxiety disorder.
Social
anxiety disorder.
Okay.
Through the case of Andy.
Okay.
Social anxiety is something that I think a lot of people struggle with, even if they don't have a formal diagnosis.
Yeah, it's very, very common. And Andy's case actually highlights how social anxiety can be intertwined with other challenges, such as panic attacks and anger management issues.
Wow, that's an interesting combination.
It is.
How did his therapist approach treating those interconnected issues?
So they relied primarily on cognitive behavioral therapy, or CBT, which is a widely used therapy for anxiety disorders.
Good.
CBT focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety.
So it's about breaking those cycles of negative thinking and replacing them with more positive and adaptive patterns.
Exactly. And in Andy's case, CBT involved several key components. So first, they used what we call psychoeducation to help Andy understand the nature of social anxiety and how it was affecting him.
Knowledge is power, as they say.
It is. And then they used cognitive restructuring to help him challenge and change those negative thoughts that were fueling his anxiety. So instead of thinking, everyone's judging me, he learned to challenge that thought and replace it with a more realistic one, like, most people are too busy worrying about themselves to judge me.
It's about shifting those thought patterns from self-criticism to self-compassion.
Precisely. And they also use breathing retraining to help him manage the physical symptoms of anxiety, like rapid heartbeat and shortness of breath.
Right, those physical symptoms can be so overwhelming and scary. It's helpful to have tools to kind of calm them down.
Absolutely. And finally, they used exposure therapy to help him gradually confront the social situations he feared.
Okay, so similar to Annie's case, they started with less anxiety-provoking situations and gradually worked their way up to more challenging ones.
Exactly. It's about taking small steps, building confidence and mastery along the way.
And did Andy benefit from this approach?
He did, yeah. Through CBT, Andy was able to reduce his social anxiety, manage his panic attacks, and develop healthier ways of expressing his anger.
That's fantastic. It's a reminder that even when anxiety is intertwined with these other challenges, that effective treatments are available.
Absolutely. And Andy's case highlights the importance of addressing the underlying factors that contribute to anxiety, rather than just treating the symptoms.
It's about getting to the root of the problem, so to speak.
Exactly.
Now, let's shift our focus to a different set of challenges, starting with the case of Cassie, a patient with obsessive-compulsive disorder, or OCD. OCD is a condition that I find really fascinating. It can manifest in so many different ways.
Yeah, it really can. And Cassie's case actually focuses on the core characteristics of OCD. So, intrusive thoughts, compulsive rituals, and the roles of uncertainty and reassurance seeking.
Can you explain those characteristics in a little more detail?
Of course. So intrusive thoughts are unwanted and distressing thoughts, images, or urges that repeatedly pop into a person's mind, often causing significant anxiety.
So it's like having these thoughts that you can't control that keep popping up even though you don't want them to.
Exactly. And compulsive rituals are repetitive behaviors or mental acts that individuals with OCD feel compelled to perform to reduce the anxiety caused by those intrusive thoughts.
So they're trying to neutralize those unwanted thoughts through these rituals.
Precisely. And the role of uncertainty comes in because individuals with OCD often struggle to tolerate the uncertainty that their intrusive thoughts might be true or might lead to negative consequences.
They get stuck in this loop of like, what if thinking.
Exactly. And that's where reassurance seeking comes in. They might repeatedly ask loved ones for reassurance, check things excessively, or engage in those mental rituals to try to convince themselves that everything is okay.
But doesn't reassurance seeking actually make OCD worse in the long run?
It can, unfortunately. While reassurance seeking might provide temporary relief, it ultimately reinforces the belief that the intrusive thoughts are dangerous and need to be controlled.
It's like a trap where the more you seek reassurance, the more power you give to those intrusive thoughts.
Exactly. And Cassie's case explores how a therapy called exposure and response prevention, or ERP, can help individuals with OCD break free from that trap.
ERP, huh? That sounds like a form of exposure therapy.
It is. So in ERP, individuals are gradually and systematically exposed to the situations or thoughts that trigger their obsessions, but they're prevented from engaging in their usual compulsive rituals.
So it's about learning to tolerate the anxiety and uncertainty without resorting to those rituals.
Precisely. And the therapist, in Cassie's case, carefully assessed her symptoms, tailored ERP to her specific fears and rituals, and addressed the ethical considerations surrounding this form of treatment.
Ethical considerations.
Yeah.
Why are those particularly important in ERP therapy?
Well, because ERP can be quite challenging for individuals with OCD. It involves intentionally confronting their fears, which can be very distressing, so the therapist needs to be very sensitive to the individual's limits, ensuring the process is safe and manageable.
Exactly. And Cassie's case really demonstrates how a skilled and compassionate therapist can navigate those ethical challenges and help individuals with OCD find relief from their symptoms.
We can.
It's a reminder that therapy, while often beneficial, needs to be approached with sensitivity, awareness, and respect for the individual's experience.
Absolutely.
Now let's delve into the realm of psychotic disorders, exploring the challenging and often misunderstood condition of schizophrenia through the case of Mr. M. Schizophrenia is a condition that's often portrayed in a very sensationalized way in the media. I'm interested in learning more about the reality of this condition.
Yeah, so Mr. M's case aims to shed light on the complexities of diagnosing and treating schizophrenia, emphasizing the importance of early intervention and family support.
Early intervention. Why is that particularly important in schizophrenia?
Because schizophrenia often has what we call a prodromal phase. It's a period of time where subtle changes in thinking, behavior, and emotions start to emerge, even before the onset of the full-blown psychosis.
Oh, I see.
Yeah, so it's like catching the condition in its early stages when interventions might be more effective in preventing a more severe course of illness.
Right, so like early detection is key.
Exactly. And Mr. M's case highlights the importance of recognizing those early warning signs and seeking help promptly.
Sometimes those early signs can be dismissed as just like teenage angst or being eccentric.
They can, yeah. And that's why it's so important to educate the public about that prodromal phase of schizophrenia so that individuals and their families can recognize the signs and seek help early on.
Right. Awareness is key.
Right.
And how did Mr. M's family play a role in his treatment?
They played a crucial role. Mr. M's family was actively involved in his care, providing emotional support, learning about schizophrenia, and helping him manage his medications.
Family support can be such a lifeline for individuals with schizophrenia.
Yeah.
Especially during those challenging times.
It really is. And Mr. M's case emphasizes the importance of involving families in the treatment process, providing them with education, resources, and support.
It's a team effort where clinicians, families, and the individual with schizophrenia all work together to kind of navigate this very challenging condition.
Absolutely. Now, let's shift our focus to Alzheimer's disease, a heartbreaking condition that affects so many families through the case of Marilyn.
Alzheimer's is a condition that I think many people fear, both for themselves and their loved ones.
It is. And Marilyn's case highlights the importance of understanding challenging behaviors in Alzheimer's disease as forms of communication.
Oh, interesting. So instead of just dismissing those behaviors as symptoms of the disease, it's about trying to understand the message behind them.
Exactly. Marilyn was exhibiting behaviors like agitation and wandering, which were initially interpreted as just part of her dementia. But her therapist took a different approach, using what we call a contextual model of dementia.
A contextual model, what does that mean?
Yeah, so it means viewing those challenging behaviors as a reflection of an interaction between Marilyn's physiological state, her learning history, and her current environment.
So it's about recognizing that those behaviors aren't just random or meaningless. They're trying to tell us something about what the individual is experiencing.
Precisely. And in Marilyn's case, this contextual model led to some important discoveries.
Okay.
They realized that her agitation was often triggered by loud noises and crowded environments. And they also discovered that her wandering was related to her past career as a teacher, as she would often look for her students.
Wow, that's fascinating how understanding someone's personal history can shed light on their current behaviors, even when they're struggling with dementia.
It is. And by understanding the triggers for Marilyn's behaviors, her caregivers were able to create a more supportive environment and reduce her distress.
Right. It's a reminder that even with a condition like Alzheimer's, where cognitive decline is inevitable, there's so much we can do to improve quality of life.
Absolutely. Now, let's delve into the often misunderstood world of borderline personality disorder.
Okay.
Or BPD. Through the case of Melissa.
Okay.
BPD is a condition that I think is often stigmatized and misrepresented in the media.
Yeah, it is. It's often portrayed in very negative ways.
It is. And Melissa's case aims to shed light on the complexities of BPD and the effectiveness of dialectical behavior therapy, or DBT, in treating this challenging condition.
DBT. I've heard that term before, but I'm not entirely sure what it involves.
Yeah, so DBT is a type of therapy that was specifically developed for BPD, and it's incredibly effective in helping individuals manage those intense emotions, improve their relationships, and reduce self-destructive behaviors.
Okay. So it's a very skills-based approach, giving individuals practical tools to cope with those overwhelming emotions and navigate really difficult situations.
Exactly. And Melissa's case beautifully illustrates how DBT can transform lives. She came into therapy struggling with intense anger, impulsivity, and a history of self-harm. Through DBT, she learned skills like mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness.
Wow, that's quite a toolkit.
It is.
Can you give me an example of how one of those skills, like how it actually helped Melissa in a real-life situation?
Sure. One of the core skills in DBT is what we call distress tolerance, which involves learning to cope with intense emotions without resorting to self-destructive behaviors. So instead of cutting herself when she felt overwhelmed, Melissa learned to use techniques like self-soothing, distraction, and radical acceptance to kind of ride out those emotional waves.
It's like giving her a life raft to navigate those turbulent waters.
Precisely. And through practicing those skills, Melissa was able to significantly reduce her self-harm behaviors and develop healthier ways of coping with her emotions.
It's amazing how learning these skills can give individuals the power to break free from those really destructive cycles.
It is. And Melissa's case highlights how DBT can help individuals with BPD create more fulfilling and stable lives. It's a reminder that even with conditions that seem incredibly challenging, there's always hope for healing and growth.
Absolutely. Now let's explore the fascinating and often debated condition of dissociative identity disorder, or DID. Through the case of Miss M, Diabetes is a condition that sparked a lot of controversy over the years.
Yeah, it has.
I'm curious to hear how this case study approaches this really complex topic.
Yeah, so Ms. Nem's case acknowledges the controversial nature of DDD while emphasizing the need for a cautious and scientifically informed approach. It highlights the challenges of diagnosis and treatment while also acknowledging the very real suffering of individuals with this condition.
So it's about finding that balance between skepticism and compassion, recognizing that while there's still much we don't understand about DDD, that it is a condition that causes real pain and requires careful attention.
Exactly. And Mrs. M's case illustrates how therapists can use a variety of techniques to help individuals with DDD manage their symptoms and improve their overall functioning. Her treatment involved a combination of cognitive restructuring, behavioral activation, mindfulness training, and even elements of DBT and ACT.
Wow, that's quite an eclectic approach.
It is.
It sounds like they were drawing from different therapies to create a personalized plan for Ms. Nem.
They were, and that's often the case with complex conditions like DD. There's no one-size-fits-all approach, and therapists need to be flexible and creative in tailoring interventions to meet the unique needs of each individual.
It's like being a master weaver, blending different threads together to create a beautiful and intricate tapestry of healing.
It is.
Now, are you ready to explore the challenging world of eating disorders through the case of Amelia?
I am.
Definitely. Eating disorders are so complex and often misunderstood. I'm really eager to learn more about how they're addressed in this case study.
Okay, then let's meet Amelia, a young woman struggling with anorexia nervosa. Her case highlights the complexities of anorexia nervosa, the challenges of treatment, and the importance of a multidisciplinary approach.
Multidisciplinary approach?
Yeah.
What does that involve?
A multidisciplinary approach to anorexia nervosa involves collaboration between therapists, nutritionists, physicians, and often family members as well.
So it's about recognizing that eating disorders aren't just about food. They're really complex conditions that affect the whole person.
Right. Exactly. And Amelia's case demonstrates how this collaborative approach can be incredibly effective in supporting recovery. Her treatment involved a combination of individual therapy, family therapy, nutritional counseling, and medical monitoring. Her treatment involved a combination of individual therapy, family therapy, nutritional counseling, and medical monitoring.
Wow, that's a comprehensive team.
It is.
How did each of those components contribute to Amelia's recovery?
Well, individual therapy using a cognitive behavioral approach helped Amelia identify and challenge those distorted thoughts and beliefs that were driving her restrictive eating patterns.
So it's about addressing those underlying psychological factors that contribute to the eating disorder.
Exactly. And family therapy helped Amelia and her family understand the role of family dynamics in her illness and develop healthier patterns of communication and interaction.
Family dynamics can play such a crucial role in eating disorders. It's important to address those relational patterns as part of the healing process.
Absolutely. And nutritional counseling provided Amelia with guidance on developing a healthy relationship with food and restoring her body to a healthy weight.
So it's not just about telling her what to eat, it's about helping her develop a sustainable and healthy approach to food.
Precisely. And medical monitoring ensured that Amelia's physical health was being closely monitored throughout her recovery process.
Eating disorders can have such serious medical consequences, so it's crucial to have that medical oversight.
Absolutely. And Amelia's case highlights how a multidisciplinary approach addressing the physical, psychological, social, and familial aspects of anorexia nervosa can create a powerful synergy for healing.
Yeah, it's a reminder that eating disorder recovery is a complex and multifaceted journey, requiring a team of dedicated professionals working together to really support the individual.
It is. Now let's shift our focus to chronic pain management, exploring the complexities of this often invisible condition through the case of a patient simply referred to as Patient M.
Chronic pain is something that I think is often misunderstood. People might assume it's all in your head, but it's a very real and debilitating condition.
It is. And Patient M's case highlights the challenges of assessing and treating chronic pain, particularly in the context of secondary gain issues, which can arise when individuals are involved in workers' compensation cases.
Secondary gain issues. What does that refer to?
So secondary gain refers to the potential benefits an individual might unconsciously receive from their symptoms, such as financial compensation or attention.
So it's not about faking their pain, but rather about unconscious motivations that might be perpetuating their symptoms.
Precisely. And Patient M's case really emphasizes the importance of a comprehensive biopsychosocial approach that considers not just the physical pain, but also the psychological, social, and even potential financial factors involved.
So it's about recognizing that pain is not just physical. It's always interwoven with our thoughts, emotions, and our life experiences.
Exactly. And in patient M's case, his therapist used a combination of biobehavioral treatment and functional capacity evaluations to address his chronic pain.
Biobehavioral treatment. That's a new one for me.
Yeah, so biobehavioral treatment combines physical therapy, psychological interventions, and lifestyle changes to address chronic pain holistically.
So it's about empowering individuals to manage their pain through a combination of physical and psychological strategies.
Exactly. And functional capacity evaluations are assessments that objectively measure an individual's physical abilities, providing valuable information for treatment planning and disability determination.
So it's about getting a clear picture of what the individual is capable of doing, physically taking into account their pain and their limitations.
Precisely.
Yeah.
And patient M's case highlights how a nuanced and comprehensive approach to chronic pain management, considering all those contributing factors, can lead to better outcomes.
Right. It's a reminder that treating chronic pain is not just about masking the symptoms. It's about helping individuals understand their pain, develop coping strategies, and find ways to live meaningful and fulfilling lives despite their limitations.
Absolutely. Now let's delve into a sensitive and ethically challenging topic, pedophilia, as explored through the case of John.
Pedophilia is a subject that's difficult to talk about, but it's important to address it with sensitivity and understanding.
It is. And John's case explores the unique challenges of treating sex offenders with intellectual disabilities.
Okay.
It highlights the need for tailored interventions, addressing social and interpersonal skill deficits, and being mindful of their potential vulnerability to coercion.
So it's a very specialized and sensitive area of clinical practice requiring a high level of expertise and ethical awareness.
Absolutely. And John's case also highlights the importance of balancing the need for treatment with the protection of potential victims.
Right. It's a delicate balance.
It is. And therapists working with this population need to be highly skilled in risk assessment, treatment planning, and ethical decision-making.
And what kind of treatment approach did John receive?
So his treatment involved a combination of cognitive behavioral therapy, relapse prevention strategies, and social skills training.
Cognitive behavioral therapy. How did that apply to pedophilia?
Well, in John's case, CBT focused on helping him identify and challenge those distorted thoughts and beliefs that were contributing to his offending behaviors. It also involved teaching him strategies to manage his urges and avoid high-risk situations.
So it's about helping him develop healthier thought patterns and behaviors, reducing the risk of reoffending.
Exactly. And relapse prevention strategies involved identifying those potential triggers for his offending behaviors and developing coping mechanisms to manage those triggers.
It's about giving him the tools to stay on track and avoid falling back into those harmful patterns.
Right. And social skills training was also important in his case because individuals with intellectual disabilities often struggle with social cues and boundaries. So the social skills training helped John develop more appropriate ways of interacting with others, reducing the risk of misinterpretations and potentially risky situations.
It's about equipping him with the social skills he needs to navigate the world safely and appropriately.
Exactly. And John's case highlights the importance of a multifaceted and individualized approach to treating pedophilia in individuals with intellectual disabilities.
It does.
It's a challenging area of clinical practice, but it's essential to address this issue with sensitivity expertise and a commitment to both public safety and the well-being of the individual.
Wow. We've covered a lot of ground today. From childhood disorders to adult disorders, we've explored a wide range of clinical challenges and the diverse ways therapists apply scientific principles to understand and treat those challenges.
We have.
It's been a fascinating journey through the landscape of clinical psychology, showcasing the compassion, the creativity, and the dedication of those working in this field.
It has. It's also been a reminder that every individual's journey is unique. There's no one-size-fits-all approach to mental health. And it's through these individual stories that we gain a deeper appreciation for the complexities of the human experience.
Absolutely. And as we continue our exploration, it's essential to remember that behind every diagnosis, every symptom, every case study, there's a human being yearning to be understood, to heal, and to live a life filled with meaning and purpose.
There is.
And that's what makes clinical psychology such a profound and inspiring field. It's about meeting individuals where they're at, honoring their unique stories, and guiding them towards a path of healing and wholeness.
It is. So stay tuned because we'll be back soon to continue our deep dive into the world of clinical psychology. It's amazing
how these case studies really reveal the power of narratives in shaping our understanding of ourselves and the world around us.
Yeah, you're right. We've seen how individuals will actually use stories to make sense of their experiences, to process trauma, to connect with others, and ultimately create meaning out of suffering.
Precisely.
Yeah.
And these case studies have subtly highlighted the role of narrative therapy, a therapeutic approach that views our lives as a series of interconnected stories, each with its own unique meaning and significance.
Yeah, it's like recognizing that we're all storytellers in our own way.
Right.
And the stories that we tell ourselves and others have the power to shape our beliefs, our emotions, even our physical well-being.
Exactly. Narrative therapy empowers individuals to kind of like re-author those stories, to challenge limiting beliefs, to reclaim their agency, and to create narratives that are more empowering, more hopeful, and more aligned with their values.
It's a beautiful and transformative approach, and I think these case studies have offered us these little glimpses into the power of narrative therapy, even when it wasn't explicitly the primary mode of treatment.
Right.
Remember how Hakim, the torture survivor, constructed his trauma narrative as part of his healing journey?
Absolutely. That process of weaving together those fragmented memories and experiences into a coherent narrative played a crucial role in his recovery.
It did.
It's a reminder that as we continue exploring the world of clinical psychology, we're not just studying conditions or treatments, we're encountering that profound power of stories to shape our lives, to heal our wounds, and to illuminate our path forward.
For sure, it's like recognizing that every individual's life is a unique and precious story, a tapestry woven from threads of joy and sorrow, triumph and adversity.
Mm-hmm.
And as clinicians, as researchers, as human beings, it's our privilege to listen to those stories with reverence, to honor their complexity, and to support individuals in creating narratives that are authentic, empowering, and life-affirming.
Beautifully said. As we move forward in our exploration of the human mind, let's carry that reverence for stories, for narratives, for that profound power of language to shape our experiences and create meaning out of this raw material of our lives.
Yeah.
What a powerful and inspiring message to carry with us. It's a reminder that the work of clinical psychology is not just about fixing what's broken. It's about honoring the wholeness of the human experience, embracing the complexities of our stories, and supporting individuals to live lives that are rich, meaningful, and deeply connected to their own unique narratives.
Absolutely. And as we conclude our deep dive into these fascinating case studies, what resonates most deeply with me is the profound resilience of the human spirit.
Me too. We've encountered individuals facing such a myriad of challenges, from anxiety and depression to trauma and psychosis, and yet time and time again we've witnessed their courage, their determination, their unwavering will to heal and to grow.
It's a testament to the power of the human spirit to adapt, to overcome, and to find meaning, even in the face of profound adversity.
It's been an incredible journey exploring the intricacies of the human mind, the nuances of clinical practice, and that boundless potential for healing and transformation. What a privilege it's been to share this deep dive with you.
The pleasure has been all mine.
As we conclude this exploration, let's carry with us the wisdom gleaned from these case studies, the inspiration drawn from these individual stories, and that unwavering belief in the human capacity for healing, growth, and connection.
Beautifully said. And until next time, keep exploring, keep questioning, and keep believing in the power of clinical psychology to make a positive difference in the world.
And remember, dear listeners, the journey of understanding the human mind is a lifelong adventure. Keep exploring, keep learning, and keep embracing the beautiful complexity of the human experience. Thanks for joining us on this deep dive, and we'll see you next time for another fascinating exploration of the human mind.